Hi everyone, this is Michelni, and with my friend Puvi, we'll be presenting the assignment 8 for clinical chemistry.
The case study. A 1-year-old girl is brought to the pediatrician clinic with a concern about her development. She had an uncomplicated birth at term. The mother reports that the baby is not achieving the normal milestones for a baby, a H. She also reports unusual odor to her urine and some areas of hypopigmentation on her skin and hair. On examination, the girl is noted to have some muscle hypotonia and microcephaly. The urine sample collected from the child is found to have mousy odor. Words we obtained from the case study are uncomplicated birth at term, not achieving the normal milestones for a baby, a H, unusual odor to her urine sample collected from the child is found to have a mousy odor. This may due to the accumulation of phenylalanine, some areas of hypopigmentation on her skin and hair. This may due to the lack of melanin production. Muscle hypotonia means poor bone strength. Microcephaly, which is often occurs because of the brain does not grow at a normal rate. From the keywords obtained, the possible diagnosis for the baby would be phenylketonuria. What is phenylketonuria? Phenylketonuria is an autosomal recessive disease which is caused by the accumulation of phenylalanine in the body. As we all know, phenylalanine is an amino acid which can be obtained from the diet. In body, it is either used to make proteins or removed by the enzyme phenylalanine hydroxylase. The figure shows the conversion of phenylketonuria to tyrosine by the enzyme phenylalanine hydroxylase. When this enzyme is defect due to the genetic mutation or alteration in DNA, the conversion of phenylalanine to tyrosine will not occur. This causes the accumulation of the substrate phenylalanine, thus become toxic and causes phenylketonuria.
Question 2. How is this disorder investigated and diagnosed? Explain in detail the method for sampling and testing. Inherited disorders like phenylketonuria can be diagnosed even when the baby is in the fetal stage using antenatal diagnosis. There are two types of antenatal diagnosis which can be used, which is chorionic villus sampling and amniotic fluid test, or is known as amniocentesis. Chorionic villus sampling. Chorion is the portion of fetal membrane that forms the side of placenta which contains chorionic villi. These villi are snipped or suctioned off for the study in the test. There are two types of procedures done. One is transcervical procedure and transabdominal procedure, which is more commonly done. Transcervical procedure. This is performed by inserting a thin plastic tube through the vagina and cervix into the placenta. Using the ultrasound images, the tube is guided to the best area for sampling and a small sample of chorionic villus tissue is then removed for analysis. This picture shows how the transcervical procedure is done. Transabdominal procedure. This is performed by inserting a needle through the abdomen and uterus into the placenta, and using the ultrasound images, the needle is guided to the best area for sampling and a small amount of tissue is drawn into the syringe for analysis. This picture shows how the transabdominal procedure is done. Next is the amniocentesis. This procedure is performed by inserting a thin, hollow needle through the abdomen and uterus into the amniotic sac away from the baby. Using ultrasound images, the needle is guided to the best area for sampling and a small amount of fluid is drawn into the syringe for analysis. This picture shows how the amniocentesis is done. Screening and sampling. For newborn babies, screening and sampling can be used to diagnose this disorder. Sampling can be done by collecting the blood sample using capillary tube from a heel prick of a baby at 3 to 5 days old. Blood will be spotted onto a card made of absorbent filter paper to form dried blood spots, and the card is then sent to the screening lab for analysis. This is known as tandem mass spectrometry, or formerly known as Guthrie test. Results showing high level of phenylalanine with low level of tyrosine indicates PKU, phenylketonuria. Once the test for phenylketonuria is positive, further blood and urine tests will be done, and genetic screening is also suggested to the parents by the doctors, which can also aid in the future treatment plan for the baby with phenylketonuria. Heel prick test. This figure shows how the capillary tube is used to obtain blood sample from the baby's feet. This figure shows the blood is being spotted onto the absorbent filter paper after being pricked. And question 4. What is the cause for this disorder? This disorder is mainly caused by the accumulation of phenylalanine in the body due to the defect in producing phenylalanine hydroxylase. What is the biochemical basis of the hypopigmentation of the hair and skin? The hypopigmentation of the hair and skin is due to decreased melanin production due to the inhibited tyrosine production. Phenylalanine is a competitive inhibitor to tyrosinase, key enzyme in the melanin synthesis. What are the complications of this disorder? Untreated phenylketonuria can lead to irreversible brain damage and marked intellectual disability within the first few months of life. Neurological problems such as seizures and tremors, abnormally small head, microcephaly, behavioral, emotional and social problems in older children and adults, significant health and developmental problems, eczema, and muscle hypertonia. This figure shows the difference between the normal head size and microcephaly. This figure shows the baby with hyperpigmentation on hair, and this picture shows the example of baby with muscle hypotonia. Treatment: a diet that is devoid of protein-rich foods. Babies with PKU need foods low in phenylalanine to prevent severe brain damage. Phenylalanine is found in most foods that have proteins such as milk, cheese, and meats. The table below shows the types of food with high phenylalanine content and low phenylalanine content. So patients with PKU can only consume foods which is low in phenylalanine to avoid the accumulation of phenylalanine in their body. Besides that, consumption of formulated nutritional supplements can promote proper growth and development for PKU babies.
That is all our presentation is about. Hope you guys learned something new. Thank you.